Introduction. Endocrinology is a fascinating and complex field of medicine that focuses on the study of the endocrine system and its various hormones. In this lecture, we will delve into the intricate details of Graves' disease, a common autoimmune disorder that affects the thyroid gland. Through this comprehensive script, we will explore the pathogenesis, clinical manifestations, diagnostic techniques, management strategies, and future directions in the treatment of Graves' disease. So let us embark on this journey to gain a deeper understanding of this intriguing condition. To comprehend the pathophysiology of Graves' disease, it is essential to understand the role of thyroid hormones. The thyroid gland produces two primary hormones, thyroxine, T4, and triiodothyronine, T3. These hormones play a critical role in regulating the body's metabolism, growth, and development. Increased levels of T4 and T3 lead to a state of hyperthyroidism, which is characteristic of Graves' disease. The excessive production of thyroid hormones sets the stage for the autoimmune cascade that characterizes this disorder. Graves' disease is primarily mediated by the production of autoantibodies against the thyroid-stimulating hormone, TSH, receptor. These antibodies, termed TSH receptor antibodies, bind to the TSH receptor on thyroid follicular cells and mimic the actions of TSH. This binding leads to the synthesis and release of excessive amounts of thyroid hormones, resulting in hyperthyroidism. The precise mechanisms underlying the development of TSH receptor antibodies are still under investigation, but genetic and environmental factors are believed to play crucial roles. Graves' disease belongs to a group of disorders known as autoimmune diseases. Autoimmune diseases occur when the body's immune system mistakenly attacks its own healthy tissues. In Graves' disease, the immune system produces antibodies that target the thyroid gland. These antibodies not only stimulate the production of thyroid hormones but also provoke an inflammatory response within the thyroid gland. This immune dysregulation contributes to the development of various clinical manifestations associated with Graves' disease. Graves' disease is frequently accompanied by ophthalmic manifestations, collectively known as Graves' ophthalmopathy or thyroid eye disease. These ocular symptoms include eyelid retraction, proptosis, bulging of the eyes, diplopia, double vision, and in severe cases, vision loss. The exact pathogenesis of ophthalmic manifestations in Graves' disease is not completely understood. However, it is believed to involve autoimmune mechanisms targeting the orbital tissues and extraocular muscles. Thyroid storm is a life-threatening complication of Graves' disease characterized by a sudden and severe exacerbation of hyperthyroidism. It is usually precipitated by stressful events such as infection, surgery, or noncompliance with antithyroid medications. Thyroid storm is associated with a myriad of symptoms, including high fever, tachycardia, delirium, and organ failure. Prompt recognition and aggressive management are crucial to prevent morbidity and mortality. Advancements in molecular genetics have shed light on the genetic predisposition to Graves' disease. Studies have revealed associations between specific human leukocyte antigen, HLA, alleles and the development of this disorder. HLA class II genes, particularly HLA-DR and HLA-DQ, have been implicated in the pathogenesis of Graves' disease. However, further research is needed to elucidate the complex genetic interactions and their interplay with environmental factors. Radioiodine uptake and scan techniques play a vital role in diagnosing and evaluating Graves' disease. Radioiodine uptake refers to the measurement of radioactive iodine uptake by the thyroid gland, which provides information about the gland's activity. A radioactive iodine scan helps identify the size, shape, and distribution of the thyroid gland, allowing differentiation between Graves' disease and other thyroid disorders. Managing Graves' disease during pregnancy and lactation presents unique challenges. Antithyroid medications, such as propylthiouracil, PTU, and methimazole, MMI, are commonly employed to control thyroid hormone levels in pregnant women with Graves' disease. Careful monitoring of thyroid function, fetal well-being, and potential risks to the mother and baby is crucial to ensure optimal outcomes. Additionally, radioactive iodine and thyroid surgery should be avoided during pregnancy due to their potential adverse effects. Graves' disease is often associated with other autoimmune conditions, forming part of a broader spectrum known as autoimmune polyendocrine syndromes. One commonly encountered syndrome is autoimmune polyendocrine syndrome type 2, APS2, also known as Schmidt syndrome. APS2 comprises a combination of Graves' disease, autoimmune adrenal insufficiency, and autoimmune thyroiditis. Understanding these associations aids in the comprehensive management of patients with Graves' disease. Graves' disease profoundly impacts a patient's quality of life. Symptoms such as palpitations, weight loss, heat intolerance, and psychological distress can significantly impair daily functioning. various tools and questionnaires have been developed to assess the quality of life in individuals affected by Graves' disease. These assessments enable clinicians to monitor the impact of treatment interventions and tailor management strategies to optimize patients' well-being. Selenium, a trace element, has been studied for its potential role in the management of Graves' disease. Research suggests that selenium supplementation may reduce the severity and progression of the autoimmune process, improving thyroid function and ophthalmic manifestations. However, the optimal dosage, duration of supplementation, and patient selection criteria require further investigation to establish evidence-based guidelines. The management of Graves' disease is evolving, with ongoing research focusing on novel therapeutic agents and treatment approaches. Targeted therapies aimed at modulating the immune response and blocking the actions of TSH receptor antibodies are being investigated. Additionally, advancements in targeted radiotherapy, immunomodulatory agents, and gene-based therapies hold promise in improving the outcomes of patients with Graves' disease. In conclusion, Graves' disease is a multifaceted autoimmune disorder that affects the thyroid gland, leading to hyperthyroidism and various clinical manifestations. Understanding the intricate interplay between genetic predisposition, autoimmunity, and environmental factors is crucial in managing this condition effectively. By integrating a comprehensive approach encompassing diagnosis, treatment, and addressing quality of life issues, healthcare providers can improve patient outcomes and enhance their overall well-being. The ongoing advancements in research hold promise for novel therapeutic options and the potential for personalized management of Graves' disease in the future.